Hi everyone, we're HIE of One. We help families manage their out-of-pocket healthcare expenses, and we built a product over the course of a weekend. Currently takes up to 48 hours to get a price comparison from a payer. You go to your doctor, they ask you to do some stuff, get some CPT codes, then you go to your payer, and then you ask them what does it cost to get this done at different providers. Now you're waiting for up to 48 hours to try to comparison shop. Total pain. Well, we solved that problem. We enable people to perform price comparisons in under 20 seconds. And we're going to demonstrate to you today. Yes, there are other price comparison tools out there, but they've got some serious issues. Cast Life Health doesn't really have a way to build an app services platform. Health Vault is inaccessible to doctors and not open source. And yes, there are things like Clear Health Costs that do price comparisons, but they don't provide personalized EOB that are corresponding payers. So our market is the 40% of Americans that worry about their out-of-pocket healthcare expenses. To efficiently reach these consumers, our sales channels are benefits brokers and group purchasing organizations, two groups that already have substantial access to people with high personal out-of-pocket costs. We provide a simple, secure solution that provides people complete ownership of their healthcare data. My Blue Button, this little thing, is a packaged personal Blue Button HIE of One. It's plug and play and serves the whole household. It acts on your behalf and doesn't require you to share your password with anyone, and it only costs $10 a month. So now we'd like to show you a working demo.
Cool, so just because this idea was born out of this need does not mean that it's not a robust ecosystem of apps built on open source software and web standards. It's already been released on GitHub, and we aim to be the Roku or Apple TV of your personal health care. So, go to HIEof1.com. Check the network settings too. I'll just talk you through. So what's going to happen is the doctor's going to send you a CCDA, and it's going to be sent to your HIE of One email address. You're going to receive a text message on your device telling you to go check your inbox. When you check your inbox, you're going to give consent to send that to your provider. There's going to be a BB Plus handshake using JSON with your insurance provider, and you're going to receive a breakdown of your potential costs from different providers. Your doctor using BB Plus Direct is also going to get an email sent back to him or her as a PDF. So you can see up on the left there, it's basically a collection of applications that open source developers would develop. And if we just click very quickly through here, we can just see what I just described. And this was all built over the weekend. Back to you, Adam.
Thank you. Thank you. So again, we use a cloud-based and open source architecture and incorporated Blue Button Plus. Yes, there are some risks, but we found ways to mitigate all of them. And bootstrapping starts today. We completed this over the weekend, launched as an open source project, and have come up with a set of next steps.
So for the business model, you said you're going to charge the patients, the actual consumers. Wouldn't it be a better idea, just thinking along the lines of travel booking sites, just charge a transaction fee to the provider who gets the business?
It's very important to us that this is a device that acts as the consumer's agent. And that gives the independence, that gives the consumers trust that the recommendations that they're getting. Otherwise, these things could be done through the EHR or through the insurance company side. But this is truly an independent thing, and just like your accountant, we want you to pay for the services that you value as independent services.
I mean, one of the questions is if I'm going to use that provider once, or if I'm going to use that surgery once, why am I paying $10 a month?
Oh, that's what the middle 40% is. It's those people that aren't just visiting one provider once a year because they're well, and they're not the ones that have overspent their out-of-pocket maximum under Obamacare. And because this is using Blue Button, it actually applies to all of your providers that are stage 2 compliant already, starting this year, and the insurance companies.
And what about pay-per-use? Is that an option? Because that's related to what I need, essentially.
Well, this is a standard open source model where you're paying for support and potentially for other services that we provide corporate clients. pay-per-use would require a metering scheme, and that would not work as well with an open source platform.
Have you thought about a way to maybe more incorporate how you help patients actually manage their healthcare spend budget for the year? That would just another way to think about if they find the low cost or the best provider for their particular issue, but then how do they think about management of their overall healthcare budget?
This is a tension, this is a competition between
Thank you, HIE of One. So